Food safety experts say it's like lightning striking twice. The very same strain of E. coli found in contaminated romaine lettuce last year is once again in romaine lettuce this year, and it's causing sickness. 32 people in 11 states and 18 people in Canada, in Ontario and Quebec, falling sick just since last month. So the warning from health officials, specifically to people in Ontario and Quebec, but of course in the U.S. as well, do not use, do not eat romaine lettuce. Throw it out. It's a strong and sweeping warning, and it made us come up with questions for my next guest, Dr. Isaac Bogoch, who's back with us, an infectious disease specialist at Toronto General Hospital. Thanks for stopping by on your way to clinic this morning.
Thanks for having me back.
Questions. This is E. coli, but it is not just any form of E. coli. This is a particularly virulent strain, I understand, 0157. Tell me about it.
So there's lots of types of E. coli, and in fact, anyone on planet Earth with a colon has E. coli in their intestinal tracts. And this is normal. This is part of our body, and it's helpful for metabolism. It's helpful for nutrition. But of course, not all E. coli is created equally, and this is a particular strain of E. coli that can be rather dangerous. This kind of E. coli can cause pretty serious gastrointestinal symptoms. It's associated with diarrhea, both watery and bloody diarrhea, abdominal cramps, sometimes nausea. And it's also associated with a particular type of kidney damage. So it's a rather dangerous form of E. coli. We can get it from eating contaminated food or contaminated water, and in this case, it's from contaminated romaine lettuce.
So that would be contaminated either from the water source or the soil in which the lettuce is grown. Is that right?
Exactly. And in fact, the produce can be contaminated with bacteria at any point along the path from where it's grown to when it makes it onto the dinner table. So investigating these outbreaks is rather challenging because there's many points of contact along the way, from where it's grown to how it's irrigated to how it's processed and packaged, and ultimately to how it makes it onto a dinner table. So the investigation is going to be rather broad for something like this. But common places of contamination are at the site of growth, for example, if it's contaminated in the soil or with the irrigation systems.
Okay, I want to come back to that in just a second, but just one point to clarify. When you say it can, this particular strain of E. coli does have serious implications. As we look to the numbers, this particular outbreak, 32 people in 11 states and 13 hospitalizations, one person in kidney failure. So it has evolved to that most severe form in this particular outbreak.
Yeah, absolutely. So, oh, pardon me.
No, I was just going to say the numbers in Canada, 18, 15 in Quebec, 3 in Ontario. So, again, sending people to hospital.
Yeah, so people have to be aware that if they've eaten romaine lettuce, they might develop symptoms within usually 3 to 4 days. That's about the incubation period for this type of infection. And luckily, most people will have either no symptoms or mild symptoms, but certainly people can develop more serious symptoms.
Should we look at the symptoms right now since you bring them up? Okay, let's pull them up. So what do people watch for in case they become infected, contaminated?
So, typically diarrhea, nausea, sometimes vomiting. The diarrhea can be watery, and sometimes it can actually be bloody. And one of the key things is when we're thinking about treating this type of E. coli, we think, oh, we have a bacterial infection, we should just treat with antibiotics. But actually, that's a huge no-no in this type of infection. And in fact, antibiotics here are contraindicated. They can actually do more harm than good. And if antibiotics are used with this particular type of infection, what can happen is it can trigger a pretty nasty cascade within the body that can result in kidney failure and kidney damage. Luckily, it's reversible in many of the cases, but sometimes it isn't, and sometimes people need dialysis. So it's rare, but it certainly can happen. So people who are infected with this particular type of E. coli should not be treated with antibiotics.
Okay, so if you're starting to feel that way, again, if we want to look at those symptoms on the graphic, and that's persistent beyond 3 days, see your doctor, and you need to think back to see whether or not you have consumed any romaine lettuce. It's such a popular form of lettuce. The other aspect, though, particularly in this case, is that there's this huge warning, this sweeping warning: do not use, do not eat, throw it out, don't put it on your restaurants, get rid of it. And if you've, you should even clean the fridge if you've had it in your fridge. And what people are worried about is they're warning so strongly, and yet there's no recall. Now, does that make any sense to you?
Yeah, I mean, this is obviously a very fluid situation, and we've only heard about this particular outbreak for about a day now. So we might see the public health agencies change their message as more is learned about it. But currently the message from the CDC in the United States and the Public Health Agency of Canada is not to consume romaine lettuce. And of course, as you point out, to clean the areas that romaine lettuce have been in contact with. And that's just because the bacteria can go from the lettuce to anything it's been in contact with. So it's just to make sure that the areas are clean.
It goes back to the whole issue you were raising, though, because there are so many potential points of contamination, it has not yet been able to determine exactly the source of the outbreak, and hence can't issue this kind of formal recall, but it is confusing.
It certainly is, and these investigations are obviously vast, but rather detailed. And really what's going to happen is the public health officials who are investigating this outbreak are really going to look at every single point of contact that this lettuce has had, from the place it's grown to the irrigation systems that help it grow, to how it's picked and where it's picked, how it's processed, how it's transported, and essentially every single step along the way from where it's grown to how it makes it onto people's table, to see where is the point of contamination and, of course, how this can be mitigated in the future. Well,
they're obviously going to be rushing to do that because it is spreading in terms of number of people affected. Iceberg, spinach, spring mix, those are all good.
So far.
No romaine.
Yeah.
So far. Dr. Bogoch, thanks as always for coming in.
Thanks
See
so
you
much
next
for having
time.
me. Take
Thanks
care.
a lot.